welcome to everyone. Thanks for joining us this morning for our Sip and Stay In with Dr. Sujatha Reddy, brought to us by AON. And Kim, thanks so much for your support of the Atlanta Women's Foundation. AON has been a great longtime supporter of ours. And in fact, we have a board member who is with AON, Kristen Adams. And so we're delighted to have y'all support of our work in the community and of this Sip and Stay In with Dr. Reddy. So, just a little bit about the Atlanta Women's Foundation and the COVID relief funds. So this, over the last 6, 7, 8 weeks now, we've been raising money to help our nonprofit partners who have been, like all of us, thrown into a tailspin by this pandemic. And so we've been raising money to help them with their most immediate needs. And we're so excited that it looks like we're going to have about $120,000 that we're going to be putting forward into the community that we've raised since March 19th. So we're really proud of that. The board will be approving that this Friday, but we're excited to be able to put those kind of funds into the community to help, again, our nonprofits that have a unique set of needs now. So so we are thrilled to be able to present this webinar, and again, it was thanks to our friends at AON. And so with that, I think we'll go ahead and get started. We've got again Kim Hurst, who's with AON, and then Dr. Sujatha Reddy, who is with Premier Care for Women. And she's also, many of y'all probably recognize her from Channel 11. She is one of their medical correspondents. And we're also thrilled that she is also a board member of the Atlanta Women's Foundation. So Dr. Reddy and Kim, if y'all want to go ahead, we'll turn it over to y'all and we can start our Sip and Stay In. I'm sipping coffee this morning in my little camper mug.
I've got my AWF mug.
Nice. Nice. And I've got mine here too. Thank you so much. I froze there for just a second, so I'm hoping our bandwidth keeps going. But thanks again for having us, Kari, and Dr. Reddy. Thanks for joining us. I thought I'd just start off with a little bit about what AON has seen since we've found ourselves in the spot that we are, and then we can jump into some questions. I know we've spent the majority of the last, call it 45 days or so, working through the immediate. So what do you do when you got to get people working from home? But it feels like we've sort of settled into our new normal, and we're thinking through how do we start bringing people back, and what does that mean? And so I thought we could have some conversation about how you begin to do that, and what are some of the things that you consider, and Dr. Reddy, you'd be so helpful in that conversation. But I thought maybe just in general, we could start with, what do you feel like we've done well in this region around the fight against COVID? Maybe you could spend a few minutes on that.
Yeah, and this is such an unprecedented time, and I want to add my thank you to AON for sponsoring this event, and it's been my privilege to be out there answering questions, talking to people about what's going on, because it's so unknown. And being a healthcare provider, we're dealing with a whole new normal as well. But to answer the question, some things that I think we have done well is the hospitals very quickly realized what was happening, and very early started making plans for how to handle this. And then as it got closer, we did things like we stopped doing elective surgeries. Having said that, anyone that had cancer, had emergencies, obviously those things went on. But for the last several weeks, we've not done any elective procedures. We've not done any really even diagnostic or elective radiologic things, like they really limited things like mammograms.
Yeah.
You didn't want to expose people and all of that. So we really took a step back and focused on how do you save all your resources for what could have been this huge onslaught of very sick people. And that's something that, when I talk to my colleagues who are in the intensive care units, who are on the COVID floors, this is a very different kind of bug. It acts quickly, and in some people it's very aggressive. So they had to be prepared. But I really think that all the hospitals in the area, and they also teamed together. There was a lot of cooperation.
Wonderful.
Where a lot of times in Atlanta, there's a lot of competition amongst hospitals. There was a lot of cooperation. So I think our hospitals were prepared. They made sure all the employees and the doctors that go to those hospitals were prepared. We had great communication, and there was a lot of cooperation in the healthcare system. And that, I think, went a long way.
That's fantastic. And hopefully that will serve the community well into the future for other emergent healthcare needs. And certainly as we begin to tackle topics like social disparities and health, for sure.
You got it.
So maybe we could talk a little bit about testing and what your thoughts are on just sort of general testing, but also antibody testing, which presumably will be important as employers begin to think about taking their employees back to work in some staged fashion.
Yeah, and I think it's amazing the education that the public has received in public health terminology, from things like flattening the curve, antigen versus antibody testing. So I'm just going to take a couple of minutes to just maybe elucidate that a little bit. So, you know, we've all seen those images of people with those long Q-tips going back to all the way to the back of their nose, and or deep in the, you know, in the throat. So the swabs that we're seeing those images of, where people are putting those Q-tips in, that is trying to diagnose if that person has active infection with COVID-19. So that's looking for the actual virus particle. You have to get back in the nasopharynx, which is that deep part of the nose, because that's where we think the virus likes to be and where it multiplies and where the infection really starts. So you get back there, you send that swab to the lab. They do a very good technique called PCR, where they're amplifying the DNA, looking for a little piece of virus, and boom, you can say that swab was positive. So that tells you who has active infection. And early on, there was lots of problems with that. That was definitely something we did not do well, you know, as far as getting enough tests. You know, I think the people who really needed them got them, but we may have been able to maybe quarantine people better if there had been more, but I think it's not worth focusing on what happened in the past. So going forward, there are availability. I've driven by a lot of some urgent cares and drugstores where they're doing these, and there's not a line of people. So, I mean, I think they're available. You still have to have symptoms. We can't test everybody. And I think the reason for that is, you know, I think a lot of people are curious, well, did I have it? Do I have it? I have a runny nose. But, you know, let's say we had enough testing to test anybody who wanted to. If you got a test today, even though you felt fine and it was negative, and you had next week another doubt, would you go get another test? There would be no way we'd have enough for that kind of testing. So there is some protocol to that. So that's the swab. Now, as far as the blood test that we're hearing about, the antibody test, so that's looking to see who's had the infection and has mounted an immune response, and that's what the antibodies are. The antibodies our bodies make for any virus are the cells that attack the virus and prevent and limit infection. So, you know how they say once you've had a certain type of virus, let's say, we'll use chickenpox, not the perfect example, we'll use chickenpox. You may get shingles when you're in your late in age, but you're not going to get chickenpox again because your body has antibodies to fight the virus. So even if chickenpox virus gets into your nose, the antibodies attack the virus, it can't give you an infection anymore. So those antibodies are looking for that. So the blood tests are looking for who has these antibodies. Now, when you look at the other coronaviruses that have been in the news in the last 10 to 20 years, this SARS and MERS, those antibodies are giving, you know, several years, if not long-term protection. So we're very hopeful that with COVID-19, someone who's had the infection, has a test for antibodies, should be protected against getting it before. Now, there's a lot of ifs and hopefuls in that.
Right.
But the reason is we just don't know. But reflecting on what we do know about other similar viruses, there's a good chance that having antibodies to COVID-19 is going to offer the person protection. And why that's important is because we didn't have enough tests early. So now we're going to, on the back end, in a way to speak, we're going to try to figure out who had COVID-19, and how that's going to help us is if we see that a large portion of a certain area has already been infected and is protected, you may be able to tell those people, listen, you can be out more than the people who haven't, because you have a much lower risk of having major complications of this virus because you are now protected. And that's going to really help us understand. So there's a lot of controversy with the antibody test too, though, because a few weeks ago, the FDA, and there's pluses and minuses to everything. So in our rush to try to get out there in front of this, we've had to sort of loosen some regulations, and you want to do that when you want to get people the medicines and the tests they need. By the same token, if you loosen them too much, you may get some bad tests. And that's what happened, unfortunately, here with the antibody test. There were a lot of false claims. And just yesterday, the FDA said we're going to now change again how they validate, or in this case, it's called FDA authorized antibody testing. But they were allowing testing manufacturers to sort of do that by themselves. And they're now taking that back into the FDA. But right now, the FDA has about 10 or 11 FDA authorized, not officially approved antibody tests that are available. And I was told in my office last week that Quest Labs has one, and they're offering it to healthcare providers, I think initially, and then we're going to let it get out there. So we're seeing a very rapid progression in how antibody testing is becoming more commonplace. It's not there yet where you can run out and get it done, but it's going to get there, and that will help us. And I think when we get that out and up and running at a with more availability, that absolutely will help us. But getting back to work is very important, but we've got to do it in a good, safe way.
Right. Well, thank you. And are those the kind of tests that eventually may be available over the counter?
Yeah, I think that's possible. One of the big things that just got slapped on the wrist by the FDA are the at-home tests, which are kind of counter. So I think eventually, but I don't think that's in the immediate future. But yeah, eventually that might be. But right now, I think it's better to get it done with one of these FDA authorized tests. The other good thing about that, I'm sorry, I know I'm talking a lot here, but
that's great.
The benefit with the antibody test is once we know who has it, the Red Cross is looking for these people, because you can go donate blood and they will take your antibodies. And that's actually been one of the very effective treatments for the people who are severely ill with COVID-19. We take somebody else's antibodies who's beat the infection, because obviously they have very good antibodies,
right?
Their antibodies, and give it to someone who needs it. And that's been a really effective treatment. So the more people we know that have had it, the more we can utilize those treatments, which is also going to help us get back to work. Because if we have a good treatment, even if we get COVID-19, we're not going to be as likely to obviously have a bad outcome, major complications, or die from it. So, antibody testing is important for several reasons.
Yeah, that's great. And I think that we've gotten a question on this conversation relative to how do you begin to bring employees back? When's the right time? And at Aon, we developed a model that allows us to sort of look at each employer's individual population wherever they are around the country and say, you're past peak, you're not past peak yet. What happens if you start to pull back on mitigation? What does that do? Does it create a second peak? So some of the things that our clients are trying to think through is how do they approach return to work, and do you take 25% of your population back first? Or when you think about the workplace, at Aon and a lot of employers, we've moved to what we call open space, where there's no offices anymore. It's supposed to be more collaborative. It is, but it can be collaborative in a bad way if you're trying to keep from sharing germs. So I wonder your thought on what are some of the things employers should think about as they begin to contemplate bringing employees back to work.
Yeah, no, I think Aon has a very unique perspective on this, because you guys are international too, and you're exactly right. What works here in Atlanta is not going to be the right thing for New Jersey or for another country. So yeah, you guys have a very unique idea there to have to tailor it. And I think that's exactly what you have to do. And that's what public health people are doing. When we look at the reopening models, it's about waiting for cases to go down. But I do think we have to be cautious and careful how we do this. So, I think you're right. That open floor plan idea, I think, is it seems like it could be a danger, but I think if people do it the right way, I think you can do it safely. So the key here is going to be that physical distancing. You know, I hate to use the term social distancing because now you're at work. So really it is about that physical distance, creating that buffer. So even if your desks are, you know, there's no separation as far as a partition or a wall, if you're 6 feet apart, that would be okay, you know, and perhaps if you, even if you have the desks in an open space, wearing facial coverings as much as possible. It gets hard to wear those for long term. I understand that. So that would be a thing. But maybe you need to, you know, like you said, return to work with less people. But you're exactly right. It's going to depend on that physical space. There's not going to be, you know, a lot of very close shoulder to shoulder meetings or, you know, social functions or events, coffees and things like that. So, but yeah, I think it's a matter of, and I've said this on Channel 11, so anyone who's watched me probably has heard me say this, but I do think in a way, it's a good way to approach when you're out and about, is you have to think that everybody you're meeting could have coronavirus. And so even if it's your neighbor at work, the person you've talked to, you know, 10 times a day, they could have coronavirus. Make sure when you talk to them now, you're going to either text on your phone or, you know, shout out, but keep that 6 feet apart. And then if you have that distance, you don't need a mask. But yeah, I think if you approach it that everyone you're meeting could have the virus, you know, I think that's a good way to think about it. The other thing with offices, it's going to be about changing workflow. Like you said, you bring back a smaller percentage. Maybe you do alternating work schedules like this, you know, if you're having A through F letter, you work at home Monday, Tuesday, Friday, or, you know, something like that. There's going to be creative solutions, but you're right. It is not going to be flip a light switch, as Dr. Fauci said, and go back to the previous way we did business. That is not the case. This is a whole new normal.
Right. And I think we also bring clients into our workspace too. And so it's not just our individual employees coming back. When do you bring people like that into your workplace? How do you clean the environment at the end of every day? I know I've been listening to Governor Cuomo in New York talk about how they have to clean all the subway cars every night. There's a lot of work.
To me, the scary part is they weren't doing that before.
I know,
but anyway,
exactly.
They're doing it now. They're just kidding. Nothing against New York City. But yeah, so I'll tell you what we have to do in our office too. Same thing, right? Because our clients are patients. So next week, we're going to have 3 doctors a day in the office. We're having to increase the time between patients because we do have to wipe down every surface. So for us, I can just tell you, and then I'll answer your question. We're going to have people check in. We're going to try to make it where they don't even have to sit in the waiting room. They're going to check in and we're going to take them back to their exam room. They're not going to sit in another waiting area. We may do their vitals in the exam room because we are having to wipe down. If a person touches anything, just like you said, you've got to wipe it down. So that's how we've had to make changes too. So medical practices, it's been very different. So as far as bringing clients in, I think one thing that's worked for us well, and I know the business world has been much better at this than the medical world, is doing things by phone or video, et cetera, as much as possible. But when you have to do an in-client meeting, I think you're going to have to limit those. I think you're going to have to reiterate, you have the right to take temperatures, which is not perfect, but one thing to do. And then I think, you know, there's no handshaking. There's going to be 6 feet for your meeting possibly, or facial coverings, you know, or both if you want to be ultra careful. But I think what we're finding is you're only going to do those meetings that are imperative, and, you know, things that can be handled elsewhere, you'll handle elsewhere. But I think when to bring them back will be also dependent on the data that you were mentioned earlier. Are your cases going down, and, you know, what's happening? Another positive, besides I think all that we talked about with the hospitals, is I think our mentality about work culture is going to evolve. You know, it used to be you went to work if you were sick because you were that team player. And now being a team player is going to mean if you have the least bit of doubt about your health, you stay home to protect your work partners. And so, yeah, I mean, I think mentality will change there too. But I do think if you bring people into your workspace, you will have to wipe down potentially touched surfaces. I would recommend masks or 6 feet of social physical distancing, or both. And I think that will not evolve for quite some time.
Yeah, and I'm a bit of a hugger too, so I'm gonna have to break that habit that I tend to go in and greet people in what I view as a warm way.
Oh, me
But
too, Kim. I hug
habits.
patients a lot, and it's really even the patients I've seen over the last several weeks. Newly pregnant women that are so excited, and I'm so happy for
Sure.
them. And it's like as you have to tell them, I'm hugging you right now. Imagine I'm hugging you because that's what I want to do, even though you can't do it. Yeah.
Right, right. Well, so we got a question. If you're tested and found not to have COVID-19, can't you still get it later, even that same day? So you're just really kind of capturing a point in time. And frankly, I think I've heard there is a relatively, I don't know, high false negative.
Yeah. So, yeah.
How do you know whether you are really positive or not?
So the swab test is if it's positive, it's very accurate. But you're right. If it's negative, there is a false negative rate. Did you get far enough swab into the nose? Is there enough virus there? So I think if someone has a swab test that's negative and is symptomatic, meaning you have a runny nose, a fever, it's actually probably more likely that it is negative, because by the time you're symptomatic is when you have the most virus. Having said that, I think if someone is very symptomatic and they get a negative swab test, then the next few days they're still sick or all the signs and symptoms point to COVID, you could get retested. So the swab test, though, again, if that's the question, is really only about active infection or recovering from an infection. It's not going to tell you if you had symptoms 3 weeks ago, getting a nasal swab isn't going to help you today. That would be the antibody testing, which I think will be available very soon. It's not out there yet. I think very soon you'll be able to go to your healthcare provider and say, I think I had this, I want to get tested.
Okay, and then if you do test positive, and when are you able to interact with other people? I think I remember hearing something about 14 days, but is it from when you test positive or from when you show symptoms?
Yeah, no, that's a great question. So if someone had a positive test, had sniffles, fever for COVID-19, what's recommended, there's two different ways you look at it. Are they in a place where they can get retested, or are they in a place where they're not going to be retested because the tests were so hard to come by? So the guidelines say, and this is from the CDC, that if you can get retested, you wait until you've had no fever for about 3 days or 7 days from your symptoms, and then you get 2 nasal swabs 24 hours apart. And if they're negative, you are no longer considered contagious, infectious. You can get out into society. If you're in that realm where you're not going to get tested, well, then it's a full 7 days from the first time you had symptoms. The 14 days is really the, if you are, let's say you were at your office and one of your coworkers that you sat 2 desks away from tested positive. Then for 14 days, you were asked to self-quarantine, monitor your symptoms, because from the moment you get exposed to COVID-19, it could take up to 14 days to show signs and symptoms. But they figured in the 14 days, if you didn't show signs or symptoms and you were able to get test negative, you did not contract COVID-19 from that person. So there's 2 different things. The 14 days was from the time someone was exposed to where you could say they didn't catch it. And then the next is if someone's positive, it's roughly 7 days from symptoms or 2 negative tests, if that makes sense.
Okay.
Different things. So, you could get exposed to COVID-19 and show symptoms as quickly as a couple of days. We typically see it about 5 to 10 days was really where the bulk of people show that they contracted it. But within 14 days, if you still felt fine, odds are you did not catch COVID-19 from that exposure.
Okay, great. Well, I don't know if you're anything like me, but I have a 10-year-old daughter who is excited about her summer camps. And she's got a couple scheduled in the mountains of North Carolina. And we actually don't know yet whether they're going to happen. So I think and then there are sort of day camps that may be happening in Atlanta. Wonder if you could speak to how, as a parent, do you navigate whether you send your child away to either a day camp or even a sleepaway camp?
Yeah, I think that, that's $1 million question.
Yeah.
I have a 4-year-old and he's got some summer camps. I'm not so sure he's excited as your daughter because I think he's been happy staying.
She's tired of me by now, that's for sure.
But I was just talking to his teacher, wondering, and they have not made a decision. You know, so far, children have largely been spared the serious complications of COVID-19. We're hearing some new reports of rare things that kids are getting, some blood vessel problems that can be very serious, but so far those have been very few and far between, thank goodness, because they're our most vulnerable and most prized asset, right? And to your heart. So children are protected. It's very hard with children, and this applies to daycares and childcare too, to have them physically distanced. That's just not going to happen. You know, someone that's 10, 12, you may be able to explain that to them. Like for these toddlers, like my child, there's no way he's going to understand that he can't run up and, you know, tag your it to his friend. He's just not going to get that. So how do we handle that? And I wish I had a magic answer for that. I think we're going to have to wait and see. I think our sort of soft reopening that we're trying to do here and slowly get back, we're going to have a better idea. I hate to say this, Kim, if we see a big resurgence and spike, I think all camps and stuff is going to be out of the question. I think if we do okay and we have this is not disappearing. We are going to have new cases, but if we have a low, steady number that we can handle, I think then it's a possibility. I'm really hopeful, and I think there's a good chance we're going to have an adequate treatment here in the next month or two. We're going to find out that one of these medications is effective. We know plasma works. And if we get a better treatment, that too will give us some sort of security in letting people get out there, because if people do get more COVID-19, we can now treat them, whereas we couldn't in March, or treat them well. So, and hopefully the medicines will decrease the risk of dying, decrease the severe complications. If we get there, maybe then there's a good hope for summer camp. It's just hard because, the kids may be okay, but if they bring it home to elderly grandparents or,
Right.
The caregivers, like if they get sick, it's a hard one. So I think it's too soon to say. I think it's really going to depend on how we all do in this reopening. If we can all behave, if I can use that term, and wear our masks and be cautious and thoughtful in how we do things, then perhaps we can have school reopening, summer camps, things like that.
Which, I'm sure all families are hoping that we can get back to something resembling our old normal. I think moving forward, certainly our normal will be different.
Yes.
I guess I'd also be curious to hear your perspective on how you feel like families in the community in Atlanta have dealt with just the whole situation of having to stay at home and the mental health burden that has the potential to create, and how you feel like the community's responded.
Yeah, I think it's been so wonderful to see so much family time. Like I've never seen whole families walking together as much as I have in my neighborhood, because there's no soccer practice and, mom and dad are home from work and, families are all together. And, it's been incredibly stressful because, parents have taken on so many multiple roles. You're working from home, but you're also having to worry about this e-learning module for your child, or you have to keep your child busy while you're taking a meeting. And that's been incredibly stressful. So I have to give it to people though. I think our communities have been in Georgia and Atlanta. I think we've done a really good job of managing all of that and still being positive. There is no question this has been an anxiety-provoking experience for everybody, and it's incredibly challenging. But I really think everyone has risen to that challenge. And in talking to friends and colleagues, we've all tried to focus on the positive, which is how much family time we've had. And, and as stressful as the days are, in some ways, they're so much less hectic, right? Because you're not like, oh, I'm late to swim class, I'm late to karate, I've got
You're not stuck in traffic.
Yeah, I'm stuck in traffic. There was all that day-to-day hectic stuff was not there in all these last several weeks. And thank goodness, because there's no way we could have done what we did all day and then manage that too. So, but I think, there was no question it was an incredibly stressful time. And I think focusing on the positives will help, and did help me get through some of it, because, it was tough. It was really tough. And again, if you watch me on television, you saw my son on a couple of my live shots, because he woke up, had a bad dream, and the only thing he wanted was me. So Yep, he sat on my lap while I talked to, Sheba Russell at Channel 11. So
That's awesome.
yeah, you got to do what you got to do. But I think Americans are an amazing people. We always rise.
Yeah. Well, and I also feel like it's allowed a lot of us to show our humanity, right? I mean, you have a child and your child has needs, and it is totally wonderful to see you prioritize that. And I think it's important for people to be able to see that side of each of us. I also feel like we've been really blessed in the South by a spectacular spring. So in many ways, we've had it, I don't know if it's easier or harder. It's easier in the sense that it's been beautiful, but it's been harder to stay socially distanced outside, I suppose, by the beautiful weather.
So I just saw Shandy asked me to review symptoms. So I'm going to break in here for a second. I'm sorry if I So the first 3 symptoms that came out early on were fever, runny nose, and any difficulty breathing. So anything like if you go up the stairs and you became short of breath, or you had a pain in your chest when you took a deep breath, those were the initial symptoms. More in the last couple of weeks, we've added some symptoms. Loss of taste or smell actually was a pretty common one. So if people, all of a sudden couldn't smell their morning cup of coffee, that was a symptom, or they couldn't taste it. So loss of taste or smell, sore throat became a symptom, headache became a symptom. So, more of the stuff that we usually see with viral infections, but the really unusual one was a loss of taste or smell. So fever, runny nose, shortness of breath were key, loss of taste or smell, headache, sore throat. You can also get, actually, some people reported some GI disturbances, a little bit of diarrhea or upset stomach feeling. Those kind of things came as well.
That's great. Thank you. I think we also had a question. What are your recommendations for home visits by healthcare providers? And how can you start a home visit? Before you answer, I'll say we've seen a great proliferation and something that we've tried to encourage employers to use more, which is telehealth.
Yes.
Using virtual visits in a way to keep people out of, we've always said hospitals are actually pretty safe places. So if you don't have to go to a hospital or a healthcare facility, it's actually better. So we have seen it, our clients use those telehealth visits more often, but I guess maybe you could speak to, the trade-off between home visits, telehealth. How do people access this healthcare system in a different way?
So yeah, I think, virtual visits, telehealth definitely is a plus that's come out of this too. And I think it's here to stay because that is a very useful tool. We definitely have been utilizing it for our patients that we would consider them, high risk, the pre-existing medical conditions. But most doctors are now doing those. Even we started doing those, and they, like I said, been very well received. There are fields that lend itself to it and some that don't. Like if you need someone to look in your ear, that's obviously not going to happen on a virtual visit. But I think that's a good way to start with a healthcare provider. And I think you just have to reach out to them and say if that's an option. And some of this is going to be being a little bit your own health advocate. If you're like, listen, I don't want to come to the office. I am nervous and frightened and scared. I want to try to get this done on telemedicine. Then, I think you need to sometimes be a little aggressive. There's been a huge accommodation. We're refilling more prescriptions without requiring people to be seen. And we're trying to be as flexible as possible. I know pharmacies are doing that as well. Home visits is an interesting thing. I know home healthcare visits from nurses have been going on, although they've backed them off a lot because that puts those people at such high risk. As far as doctor house calls, I have to say I've not heard of that happening yet to any frequency, but telehealth is absolutely here to stay and a very useful tool for consultations, discussions. It's been very helpful for us in our office.
That's great. I know my daughter actually takes ADHD medicine, so she has to see her provider. So they check in. We did that on a visit.
I think it's a perfect visit for telehealth. Yeah.
Yeah, it worked very smoothly, and I think we're actively encouraging people who are seeking out behavioral health services to use telehealth. It's a very good way to access relief to the extent that people need that during stressful times as well. I think there was also a question about, and you may have touched on this a little bit, the antibody tests that are currently on the market. I wasn't sure if they were actually in the market, so maybe you could speak to that. And the question was really around how accurate and standardized are they? This may have been something you're alluding to around the CDC taking another look at that, or FDA.
Yeah, the FDA, exactly. So there are some out there, like I had mentioned, Quest has one. Right now they're offering it to healthcare providers. It's going to slowly ramp up. The accuracy, and that's been the dilemma, the FDA has not granted approval to any of them because that's a very long process, but they've authorized some. So if you're thinking about getting the antibody test because you think you had this or want to know or concerned or it's going to affect how you live your life going forward, I think getting one of the FDA authorized ones is a way to go. The first thing I would do is if you have a healthcare provider, call your general provider and ask them if they have it available. That'd be the easiest way to do it. You could even just try your health department, or the big hospital systems may have to call. But I would first start with calling your healthcare provider to see if that's out there. The ones that have been authorized seem to be pretty accurate. Again, and I'm hedging a bit because there's just no real concrete answer here. The test itself is not a super complicated one, which is why a lot of the hospitals said they were going to do their own. It's a pretty easy test to create. So that's the good news. But again, I think this is a little bit of buyer beware. And I personally would not use one of the ones that was not FDA authorized. I think if it's a big company like a Quest, a LabCorp, I think that I would I would feel more comfortable with something like that.
Yeah. I think as I understood it, and maybe you could speak to this, they have to, in order to be authorized, they have to run the test, but they have to run a parallel test that gets the same result. And so there is some, in order to get to that authorization, there's some pretty good steps that they have to go through to.
Yes, for the FDA. So the problem was, again, early on, and if I'm repeating just in case someone missed it, the FDA said they would allow the labs running the antibody test to sort of self-validate.
That's yes.
Have a good test, and then they would just get to do it. And they've realized that opened up the market because, people are, there are people out there trying to always make a fast, dishonest, possibly buck. So that was sort of Wild West. And then they started granting these authorizations, which are a step below approval, but still good. So they've now taken away that ability to do the self-validation. And I think that's okay. I think there's no point in having a bad test on the market. That's not going to help.
Right. So we also have one question around the minimum amount of PPE that a person could wear, and personal protective equipment. And, I go out and I see people, I put a scarf over my face. That's my mask. I always make sure I cover my nose, try not to touch my face. I had a pair of gloves, but once you use a pair of gloves, they're not really good anymore. So what's the right balance of all that stuff that you can kind of make from home? Do you wear your, do you compromise and use your ski gloves to cover your hands?
So just to backtrack for a second, the main way you're going to get COVID-19 is through droplets. So somebody who has the virus coughs, sneezes, talks, a little bit of spit, nasal secretion, something goes out and gets onto a non-infected person, goes into their nose, mouth, possibly eyes, harder to get in the eyes, but possibly eyes, that person gets sick. So the idea of touching surfaces is scary, but not really what we have to worry about. So I think, just like you said, I think covering a cloth face mask, anything like that, going out should be sufficient, especially if you're hand sanitizing and washing hands. So I can tell you, for me, when I've gone to my now most enjoyable trip of the week is to the grocery store. When I've gone to Kroger, I've worn a mask. I have not worn gloves, because the other thing that I've seen with people wearing gloves is it gives you a false sense of security. All of a sudden you're doing all kinds of things, whereas if you don't have gloves, you're a little more thoughtful and cautious with what you're doing. But if you look at, you know, what the CDC and WHO tell us, there hasn't still been a case that someone touched a contaminated surface and gave themselves COVID-19. It's a theory and it's a concern, but that is really not where you're going to get it. It's person to person, which is where that 6 feet is the key. So a cloth or any kind of face mask, I think, is all you would need to do to go out into grocery store, you know, whatever errands you're running. I think, you know, I think that's all you really need. It's also been very disheartening to see all those gloves on the floor in the parking lots. I mean, that's just terrible, you know?
Right.
And so, yeah, I don't think that that's obviously throwing your gloves on the floor is a good thing. But again, I can tell you, I think if you cover your face and your nose and your mouth, you're going to be in good shape, in my opinion. And that's all I also don't wipe down my groceries.
I was going to ask you that. That's that in takeout containers. You know, we're still doing takeout in our household, and you know, I know some people who are wiping everything down, and I was curious about that as well. That's helpful.
I've not been wiping anything down. I've always been, with my job, it's just part of it. I'm a avid hand washer, so I've always had a bottle of hand sanitizer in the door of my car. I open the car door, I sanitize. It's just always how I've been. So I think if you're a good hand washer, I think you should be in good shape. I've not wiped down takeout containers or groceries. You know, I wash my hands, though, I will tell you, after I touch them. If you're, instead of wiping down and wasting those precious Clorox or Lysol wipes, if you leave your groceries out for a day or two, the non-perishables, on a table and don't touch them, if there's any live virus, it should be gone.
Okay, that's really very helpful. I think none of us like to create more waste than we have to exist out there. So being smart about what we do is fantastic. Well, I think that we've covered a lot of the questions that have come through. I wonder if you just have any more thoughts just in general about how we think going forward. Everybody's anxious, right, to get, I believe we're sort of leaving behind the idea that we're going to go back to exactly where we were before. There were probably some good habits, like I don't need to hug everybody when I greet them, that may not come back. But as we begin again to think forward, respecting social distancing and things like that, but what are your thoughts on how we think as optimistically as we humans like to be about the future and getting back to something that feels more a natural rhythm to our lives?
Yeah, and I am a very positive person, and I think we should be hopeful and think positive. I think we did a great job staying at home. I think, and that got us over that hump. We flattened the curve. We did not overwhelm our healthcare system. So the whole idea there was that if we had a massive peak and a lot of people got severely ill and needed an ICU bed with a ventilator or just an ICU bed, critical care would not be available to everybody. And in a country like America in 2020, to think that we were going to lose people because we couldn't give them the care they needed, that's heartbreaking. And that should not have happened, and it didn't. And it's because we all did what we needed to do. We stayed home, we flatten the curve. So now going forward, I have no doubt we are going to continue to see new cases. If we can see them at a low, steady level, that's as good as it's going to get for us. And I think we absolutely can do that. So going forward, I think what we have to do is what we've been talking about. We're going to go out there, we're going to get out, but we're going to do it in a thoughtful way. How we do business, how we go to dinner, how we go to sporting events, how we go to movies is going to be different. We're not going to be elbow to elbow anymore. There's going to be space. When you go to the doctor, it's going to be different, but I think that's okay. I hope down the road, like you and me, we'll be able to hug our clients and our patients like we like to, or shake hands as much as we want to, but not yet, not yet. So I think you do this slowly. Now we're all going to slowly go back to work. I think you do that, and then we kind of see how we do. And then maybe then we start thinking about the next phase. We go out to dinner a little bit more. We go get our hair cut. We get our nails done. And as we slowly increase our activity, I think we watch how we do. If we start to see things getting crazy, then maybe we have to pull back a little. But I agree with you. We're not going to, I don't think we're going to have to go back, I hope, to that lockdown again, because that is very hard. So economically and emotionally. So I think if we do things slowly and thoughtfully and carefully, I really think we're gonna be okay. I know those new numbers that just came out this morning were very frightening, that we could see a huge peak with the loosening. But I think if we're gonna be out in the malls, I think, and you're gonna not be able to keep 6 feet, masks are gonna protect the other people and yourself. So I would highly recommend people do that. And that
That's
would be, to your question, the minimal PPE would be a facial covering, in my opinion.
Which is great. I can tell you one thing I will not miss is the middle seat in an airplane. As someone who flies a lot. If the airlines all agree to give up on the middle seat, I think we'll all be in a much better spot. That's for sure. We had one more question come in about caregivers and underlying health conditions. Like, how do you recommend we manage through various caregivers? I have a nanny for my daughter, for example. She hasn't come to our house since this all began. And how do you start to bring those people back in?
So if people have been listening to the shelter in place orders, and if they've been home and limiting their exposures and they're symptom free, I think you can let them back in your home. I think we can start to have family visits and small play dates and things like that, especially if you know the person and you trust that they really have been in their home and been careful. Then I think, you can start doing that. I think a nanny is a perfect example of someone, it'll bring back some normalcy to your life. But yeah, as long as this is the same with going back to work, you're going to make sure they don't have a fever, they don't have any symptoms, and you're going to count on her to be honest. You could take her temperature if that's important, it can't hurt anything. But I think we're going to slowly get back to that. Yeah. I think it also is going to depend though. I think every individual situation is different. So my parents are obviously over 65 and they live with me. So I'm taking things even a little bit slower, because every time I leave the house, it's not just about me, it's what I'm bringing back to them. So I have not rushed to get my son a haircut because he needs one very badly, but I'm a little worried. I'm worried for him and I'm worried for them. So he'll have to just brush the hair out of his eyes for a few more weeks. And I because for me, it's a little different situation. If I was by myself, I might be able to go, and maybe I would go get a haircut sooner. But I think we all have to individualize a little bit. So like if you had your nanny, but then you had an elder parent or relative with you, you may not have your nanny come or have them stay away from each other. So there's going to be a little bit of creativity here and individuality that we're going to have to apply to our situations, because you may have, someone may have a spouse who's 45, but has a kidney transplant. And that's going to be someone who you're going to have to watch very carefully and limit their exposures. So that person, maybe you don't go out as much, so there's going to be a lot of it where we're going to have to make smart, careful decisions for our individual situation.
Yeah, that's great. That's really helpful. I've heard reference to herd immunity.
Mm-hmm.
We got, will everyone eventually get this virus, and is maybe that a good thing when we get to that point?
So I think herd immunity is a very important concept. And here again, the public's getting a huge public health education. So to get herd immunity for something like measles, it requires about 97 to 99% of the population to be vaccinated or have gotten the infection to be immune. So we're a long way off from having herd immunity with coronavirus. And the problem with saying, because I've had some people say, well, why not just let everybody just get it and worry about it? Well, the problem is you would overwhelm the healthcare system. Because if we think about the 20% of the people that need to go to the hospital, if we have 100 million people doing that, we don't have enough hospital beds, even close to, for 20 million people. So with this right now, that is not what we need to do, is just let everyone get it. That wouldn't work. But to get herd immunity, which is a great important concept, it requires a very high infection rate or vaccination rate. I do think before we get to that in society, we will have a vaccine. I'm quite hopeful. This is not a very tricky virus. I'm really hopeful we'll have a vaccine for it. Mind you, I think it's going to be till next year. But once we have that, and if we get enough people vaccinated and we get a good treatment, we know that if someone does get very sick, we can treat them with this medication that's going to decrease their risk of dying. It's going to be a whole different world for us. And then maybe you and I can go back to hugging people.
Yeah, that would be so nice. Well, we have one last question related to this. We're all sort of going a little bit crazy with homeschooling. and have found a newfound or a deeper found appreciation for teachers. Just kind of curious what you think about the likelihood that school will start as normal or as scheduled in the fall.
I'm really hopeful it will. I think by the fall, we're going to know with our getting out there now, that's going to give us several months to see how we do. And I think if we all do this and it goes the way I think it will, if we're all still careful, I think in the fall, we'll still be aware of coronavirus. I think we will be doing masks and, be cautious. I'm really hopeful school will open. It's going to be different. I think desks are going to be farther apart. We're going to be sanitizing a lot more, but teachers have been troopers with their immune system as far as flus and colds and all of that, and they've managed. So I give them a lot of credit for what they've done up till now, and I think they will be okay. But perhaps we won't have teachers who are high risk or people that have high risk people at home. Like if a teacher is married to someone who has a heart transplant, they may not go back to teaching in the fall. And there's going to be, again, individual things, but I think schools will be very different. We may be letting the kids do a lot more on their own. It's going to be interesting, but again, hopefully by the fall, if we have a decent medication, it will allow us to do more of these things. But I think we're just going to have to wait and see.
Yeah, I have to say, I'm pretty pleased my daughter's picked up some more executive functioning skills, as they like to say. Now she's getting her own. Actually starts class in 10 minutes and she's got to get herself ready all by herself. And that's a good thing as a 10-year-old to pick up a few additional
independence.
Exactly.
Yeah.
Exactly. Well, listen, Dr. Reddy, thank you so much. I mean, I think this has been a great dialogue, and I want to thank everybody who dialed in for questions. I think we've covered most of them. Kari, I don't know if you want to jump in with a couple observations as well. Thank you for the opportunity.
Oh my goodness. Well, thank you both so much for this really important conversation. And, obviously, Dr. Reddy, all of your, your insight and knowledge. Thank you so much for sharing that, obviously this is on the front of everyone's mind every day right now. So I hope that everyone who has joined us has enjoyed this time and have your questions have been answered. There were so many questions. I think there were more than what we could get to.
Oh.
So, but we will probably be continuing some of this conversation in a couple of weeks with our upcoming Women in Healthcare event, which Dr. Reddy is the chair of. I don't know, do you want to share any about that?
Yes, I would love to. And I want to say thank you to all the attendees. It's just been so wonderful that everybody participated and asked questions. And I just love this. And I love AWF, the work that it does. And thank you so much, Kim and Aon, for sponsoring this and allowing us to have this forum. And I'm thrilled to do it. So a couple things. Yes, so we had to postpone our Women in Healthcare event. We are fortunate enough to have Dr. Patrice Harris, who's the president of the AMA and a local Atlanta resident. She's a practicing psychiatrist. And we're having an event focusing on mental health and anxiety, specifically in teens and teen moms. And we had to postpone a live panel Q&A event to doing it virtual. It's going to be on May 21st. It's going to be very similar to this. And then we're going to go over a lot of very pertinent things that have been going on for people with anxiety and depression and things like that. So we'd love you to participate. It's open to the public. So again, May 21st will be on the AWF website. And I'm going to switch gears for a second from being the speaker here to being the Atlanta Women's Foundation board member, and put that board member hat on. And just going to ask everyone that it is Giving Tuesday. They've changed that date. Today is Giving Tuesday. We'd appreciate anything anyone could do to help us and make a donation so we can continue our work with helping people so affected by COVID-19 and what it's done to nonprofits and their ability to help people and the number of people that need help. We've seen the video on TV of the lines of people at food banks. And so whatever we need to do, we can do. So we'd really appreciate whatever anyone can do to help us out with that mission would really be greatly appreciated. So, grab a margarita, click the link for Cinco de Mayo and make a donation to AWF. And thank you again, everybody, for your attendance and patience and great questions. I really appreciate it.
Yeah, great.
Well, I think that concludes our session this morning. Again, thank you all for attending. Please, I hope everyone stays healthy and well. And as we've all been saying, we'll get through this together. So thank you again so much. And everyone, Have a great day.
Bye. Thank you.
Bye-bye.
Thank you.